Good day. I'm Roger Dmochowski, and on behalf of my co-investigators, I'd like to present to you our trial entitled Safety, Efficacy, and Quality of Life Improvement in Women with Prior Stress Incontinence Surgery Treated with Autologous Muscle-Derived Cells, experienced from two double-blind, randomized, placebo-controlled trials. My affiliation is as noted. This study was sponsored by Cookman, who have had prior surgical intervention for stress urinary incontinence, or a population that has challenging issues associated with their symptoms. These patients often have higher safety risks and diminished efficacy from secondary procedures, and also have higher reported rates of leaks and also decrement to quality of life. In the year 2020, the Food and Drug Administration, taking the above in light, granted regenerative medicine advanced therapy, or RMAT designation, to this particular cellular therapy, acknowledging the specific needs of this population. We sought to retrospectively review two trials that had been done in randomized controlled fashion as compared to placebo, the UIAD trial and the IND trial, for purposes of assessment of response of post-surgical patients to intervention with muscle therapy versus placebo. It's important to note that those patients who received placebo at 1 year could receive active therapy if they. This is the study disposition. Patients were studied and followed after treatment at up to 48 hours initially, and then 1, 3, 6, 12, and 24 months. The primary outcome was stress incontinence episode frequency, or CIF, reduction on a 3-day bladder diary assessment. There was also a variety of quality of life assessments, including IQOL, IIQ, GQOL, UDI, and ISI. Overall, the responder was defined as greater than or equal to 75% reduction in the CIF, or stress incontinence reduction episodes at. Subject inclusion criteria were adult women with 3 or more stress urinary incontinence episodes on a 3-day diary, who were randomized on a 2-to-1 basis to active versus placebo. The remainder of the criteria are as noted on this slide. The AMDC investigational product was delivered after biopsy. The biopsy is obtained from the vastus lateralis in the leg. It is produced and expanded in clinical sterile circumstances, and then shipped back for injection with an approximating needle that injects directly into the external sphincteric mechanism. It is the first biologic approved for this, investigated for this indication, and again is injected into the external sphincter in a procedure that's 3 minutes or less, and it's hypothesized that these cells engraft into the native cells for purposes of rejuvenation of the preliminary data in the demographics indicated a typical stress urinary incontinence population, 1 to 5 prior surgeries, with the experience of those patients who had had prior surgery. 75% of patients had had prior mid-urethral slings, and the overall duration of symptoms was quite extended at an average of 12 years with a substantial overall primary outcome, which was a reduction in stress incontinence episodes of CIF reduction. What's noted is at 12 months of substantial separation from placebo, which was highly statistically significant, of 75% or more. Interestingly, when we compare then the second 12-month segment, we see that the placebo group, after receiving active treatment, then very closely approximates the experience of those individuals who received primary therapy. Interestingly, this 75% reduction correlates very nicely with the MID for the IQOL, and as can be seen with those patients who are 75% or reduction or more, was a very high correlation with the 10-point MID change, which is considered to be statistically significant in terms of improvement for women with stress. This also correlated substantially with improvements from a statistical standpoint in all the other domains of quality of life that were evaluated at 12 months, and so therefore stress incontinence reduction had a substantial impact from a standpoint of positivity across the domains measured by these various quality of life. Treatment, the active treatment, was well tolerated with no serious adverse events associated with the actual AMDC administration. The sites reviewed each adverse event for possible, probable, and a definitive relation to the product or the procedure, and the following. Blinded treatment. The patients were compared to placebo, and the similar adverse events were associated between both the active and placebo arms. Dysuria was the most frequent adverse event, 3.1% in the active versus 5.8% in the placebo group. The most frequently reported injection site-related discomfort was injection site-related pain. There were 3 episodes of urinary retention, 1 in the placebo group requiring catheterization, and 2 patients in the active arm who had high or elevated post-void residuals that did not require catheterization. There was 1 subject who experienced a biopsy-related serious adverse event of periprocedural pain that required hospitalization for pain control for 2 days and resolved totally in 4 days. Procedural pain, post-procedural contusion, and post-procedural hematoma was the most common related adverse events associated with the actual leg. Conclusions of the safety aspect of the trial that there were no serious adverse events associated with the product. There were similar overall adverse events between the active and placebo arms. Overall dysuria was the most frequent reported adverse event at 3.1% in active versus 5.8% in placebo. Injection site-related pain was more common in the autologous group with 7.7% versus placebo. Dysuria was encountered in 4.6% of the active arm versus 5.9% of the placebo arm. And biopsy-related adverse events were most commonly associated with procedural pain in 4.8%. The study demonstrated significant benefit for women with post-surgical persistent incontinence. The overall effect was durable in 66% of the patients, achieving 75% or more reduction, and changes in quality of life and symptom severity paralleled very nicely reduction in stress incontinence episodes. Therefore, this therapy appears to address the unmet medical need associated with recurrent urinary incontinence and the significant quality of life disruption associated with that condition. Thank you very much.